I have tried diet after diet after diet, and I've not had a lifetime success. I'm a great dieter, but trying to maintain my weight loss has always been difficult for me. I reach my goal, and then before I know it, I've gained that weight back. I've been thinking about bariatric surgery for the past year, and that's because I've had some medical conditions that have developed, and they're related to my obesity, even though I didn't want to realize it at first. Well, I'm the patient navigator for the Weight Management Center, and actually what I do is I assist patients from the very beginning of their journey of weight loss to after surgery, and then I follow them for 5 years afterwards. Just seeing patient after patient happy, successful, I decided it's time for me to get healthy. My ultimate goal would be to lose 85 pounds. Even though I'm the patient navigator for the Weight Management Center, I did have to attend all the classes. Insurance dictates how long your program has to be, and as an employee of this hospital, our program is a 6-month program. When I first started this job, I did sit in and listen to all the classes. However, when it became more important to me and really learning what I needed to know for my surgery, I did pick up some extra tidbits that I had not really thought about that would be helpful for me. I will be having the sleeve procedure. Dr. Richard Borse is my bariatric surgeon. I'm looking at being healthier, actually being more motivated to get out there and be physical, enjoy time with my grandkids. I have twin 5-year-old grandkids, and I want to be able to spend time with them. And they like to go swimming. I'd like to be able to feel more comfortable in a swimming suit and being out there with them and being active rather than feeling self-conscious. I've seen a lot of successful patients that I was able to help, and I realized I want that success for myself too. It's my turn. It really is. I started at 215, so now I'm down to 130. I have lost 85 pounds. I didn't expect to meet this goal this quickly. I was allowing myself 18 months, but I've only been out 8 months, and this was my original goal to achieve this. I feel great. I have a lot more energy. I'm off my blood pressure medicine. I'm off my CPAP machine, and I'm just enjoying feeling healthier and shopping for all new clothes. This past weekend I went shopping with my mom, and this is the first time I've gone into a dressing room and asked her to go get a smaller size. That is amazing. My children are very happy to see that I'm happy. They've never seen me at this weight. They've only known me in the heavier side. My husband says this was close to my dating level. He has switched up his main meal for me. He eats his bigger meal at lunch so that when I come home, we're just eating a small dinner. I thought I would struggle a little bit more, just because when you've become obese, you've developed a lot of bad habits, and I thought it would take me more time to switch those bad habits. But actually, the surgery actually helps you. I had the sleeve procedure, and they remove part of your stomach, and with that stomach, they remove a hormone called ghrelin. So with that gone, my appetite is reduced, and I don't crave the food that I used to crave. I would say there's no foods that I really miss, because my mindset is nothing is off my table that I can't have. Recently, I took my grandkids for ice cream, and I had said before I left, if I really wanted the ice cream, I was going to allow myself to have a little ice cream. But when I got there and I thought about it, do I really want it? Do I really need it? I just had a glass of water, enjoyed the time with my grandkids. They had their ice cream and were happy, and I didn't feel like I was deprived or missing anything. It's not all weight loss due to the surgery. I've been increasing my activity, and it got easier as I lost the weight. Within the last 6 weeks, I've joined a class, which is called the Pound class. You get a good exercise, and I actually smile and laugh and enjoy it when I'm there. Prior to this, I would not have even considered going into an exercise class. I was too self-conscious about my size and not being physically active and fit. I am sharing my experience with my patients. I do have patients that will call up and say they're nervous, they want to talk about it, and I tell them, any questions you have, please call me. In fact, this morning I had a patient that's nervous. I said, well, let's go back in my office and we'll talk about it. And I don't mind personal questions either. A lot of times it's about loose skin, and I do have some loose skin. If it bothers you enough, then you can have some plastic surgery done, which may be in my future. It's changed me because you always had that thought, like, I wish I was back to my lower weight. And now I have the confidence to say, you can do it. I feel happier. I really am happy that I've got my life back.